Let's talk about hip flexor flexibility. The hip flexors attach our femur, our leg bone, to our spine, to our lower backs, and when they're tight, they can create a compressive load on the spine. So to test your hip flexor flexibility, pretty simply, you can just put one foot in front, one foot behind, and that back leg side, squeeze your butt, kind of push your hip forward on that side. You should feel a little stretch on the muscles in the front there. To add to that stretch, you can reach up and over, and then you can even twist yourself away to accentuate the stretch. Now, when we talk about starting to progress this and moving towards the flexibility standard that we have, you need to go to the ground because we need to start to add some knee flexion into the equation. So the hip flexor is a two-joint muscle, meaning it crosses the hip and the knee. So you can start to add some challenge to this by bending your knee, and you can even grab your foot. If you need to hold on the wall for balance, that's fine. To make it really intense, you squeeze your butt on the back leg side. Now the standard for this is to be able to get your knee right by the wall. I like to use a pillow because it's kind of uncomfortable. And then to be able to get your back to the wall. So knee on the ground, foot on the wall, back to the wall. Now that's a ton of flexibility in the front here, and it takes a long time to achieve that. So in order to get there, you need to just progressively load up on your stretching, on your flexibility exercises, and that makes it really simple because you just do 2 to 5 minutes a day of these stretches as we lay out in the pictures, and eventually you'll get to the point where you can get your foot up on the wall and push yourself back into the wall.